A large portion of questions on the EPPP exam come down to priority. You are deciding what needs to happen first, given the situation in front of you. These questions can be challenging because multiple answer choices may describe actions that could be appropriate at some point. The correct answer reflects what makes sense now, based on the level of risk, the amount of information available, the timing of the decision, and the psychologist's role in the situation. Priority questions are different from questions that simply ask whether an action is helpful. A treatment plan may be helpful, a referral may be helpful. Consultation, documentation, further assessment, or safety planning may also be helpful. The issue is whether that action fits the immediate decision point. The exam often tests whether you can separate what might happen later from what needs to happen first. One of the most consistent patterns involves safety. When a scenario includes clear and immediate risk, the response focuses on protection. That may involve protecting the client, protecting another person, or taking steps to reduce danger in the environment. The exact action depends on the details provided. The broader principle is that immediate safety takes priority over interpretation, rapport building, long-term treatment planning, or routine assessment. Risk may be stated directly, or it may be implied. A client might describe an intent to harm themselves or someone else. A scenario might mention access to means, a specific target, escalating behavior, impaired judgment, or recent major losses. Those details matter because they help determine whether the situation requires immediate action or continued assessment. In other situations, risk is not present or has not been clearly established. In those cases, the next step often involves clarifying the situation before choosing a more involved response. Acting too quickly can create an answer that feels decisive but does not fit the information provided. The exam frequently tests whether you can recognize when there is enough information to act and when the responsible response is to gather, clarify, or verify information first. This is where sequencing is important. Sequencing means identifying the proper order of steps. Many answer choices may describe actions that are reasonable in a full course of care. The question usually asks for the next step, which is narrower. The correct answer depends on where the psychologist is in the process. For example, imagine that a psychologist has completed an initial intake with a client who reports depressive symptoms. The client describes low energy, reduced interest in activities, and difficulty concentrating. They deny suicidal thoughts, have no history of self-harm, and do not describe current risk to anyone else. The question asks what the psychologist should do next before selecting a specific intervention approach. Multiple options may initially seem reasonable. Beginning a structured intervention may come to mind because the client is describing distress. Providing general coping strategies may sound supportive. Referring for a medication evaluation may be useful in some circumstances. A closer look at the question shows that the issue is not whether these actions might eventually help. The issue is whether the psychologist is far enough along in the process to choose that step now. In this type of situation, the stronger response is to clarify the client's needs and treatment goals before selecting a specific intervention. That might involve assessing functional impairment more carefully, identifying the client's priorities, or gathering additional information about symptom patterns. The question is asking what should happen next in the sequence, not what might be part of the overall course of care. Now consider a different situation. A client states that they intend to harm a specific person and describes a plan to do so later that day. The question asks for the most appropriate next step. Here, the details change the priority. The client has identified a target, described intent, and provided a time frame. Those details indicate immediate and credible risk. The response shifts toward protection and risk management. Continuing routine assessment or exploring the client's feelings in depth would not match the urgency of the situation. The psychologist still uses clinical judgment, but the first priority is safety. These two examples show why priority and sequencing matter. Some questions turn on whether risk is present, others turn on whether the psychologist is far enough along in the process to take a particular action. The same general answer choice can be correct in one scenario and incorrect in another because the timing is different. Another common error involves choosing the most comprehensive answer. Comprehensive answers can sound appealing because they seem thorough. They may include assessment, treatment planning, referral, follow-up, and documentation. The problem is that the exam often asks for a focused response. The correct answer may be smaller and more immediate because it matches the current decision point. A useful question to ask is, what needs to happen first? This keeps your attention on sequencing. It helps separate answers that are appropriate later from answers that fit the immediate situation. A second useful question is, do I have enough information to act? If the answer is no, the next step often involves assessment, clarification, consultation, or gathering collateral information. If the answer is yes and the situation includes clear risk, the next step usually involves protective action. A third question is, what would happen if I chose this answer now? This helps identify responses that are premature or disproportionate. If an answer assumes facts that are not in the scenario, it may be moving too quickly. If an answer delays action in a high-risk situation, it may be too passive. As you practice, these patterns become easier to recognize. You begin to see how risk, timing, available information, and role responsibilities interact. The goal is to develop a consistent way of thinking through priority questions, so your answer reflects the situation in front of you rather than the answer that sounds most familiar or most complete. Priority and sequencing questions reward disciplined decision-making. They ask you to identify the step that fits now. When you focus on risk, information, timing, and role, you reduce the chance of selecting an answer that is out of sequence or out of proportion to the situation.